Coming up, I'll be joined by Connie Bernardy, and we'll be speaking about Active Living Ramsey Communities. That's next on the St. Paul Forum. Welcome to the St. Paul Forum. I'm John Forde. I'm joined today by Connie Bernardy with Active Living Ramsey Communities.
Hello, John. How are you doing?
Welcome, Connie.
Thank you.
Now, you have an illustrious story. I'm not going to say checkered. You have an interesting past. You were a former state representative.
Yes, I did. I represented the communities of Ramsey County, Anoka County, as well as Mounds View, Fridley, Spring Lake Park, Mounds View, and Coon Rapids,
And what was the
Blaine.
district? District number?
Well, they're different. I was
Oh,
in two
it's
different,
moved.
yeah,
Okay.
but 48 at B and 51B.
So you straddled a decade line? Is that what it means?
Yes, that's
you
what
got
that means.
redistricted?
Redistricted,
And you
right.
hung on through it.
Yeah, exactly.
Good for you.
40% new district. You know, can't make anything easy.
Okay, good. Let's go further back. You were born in the Twin Cities?
Yes, I was born in the Twin
You went to
Cities.
Spring Lake Park High School.
Yeah, very good.
Okay,
You've done your
that's
research.
really
This is
all I do
good.
know. Yeah.
Well, that's good.
Okay.
Yeah, I'm homegrown, and I still live here with our family, and I've worked in Ramsey County for many, many years.
Okay, pre-politics, you were doing some other kind of work, you said.
Well, actually, I originally worked at Honeywell, and then I went into coalition work with the communities of Roseville, Falcon Heights, Lauderdale, and Little Canada, and we worked on what was called at the time Mayor's Commission Against Drugs. And our goal was to create safe and healthy communities by helping focus on healthy youth development and making sure that alcohol and tobacco did not get in the hands of young people.
Tell me about Active Living Ramsey Communities.
Well, Active Living Ramsey Communities has been going on since about the end of 2004, and it really was the brainchild of Commissioner Jan Parker. And she had gone to a national conference, and they talked about how communities can become healthier and improve health, especially to reduce childhood obesity. It's become an epidemic in our country. So many people are either overweight or obese, and a lot of it's based on the infrastructure and policies we have in this country, making sometimes the easy choice the hardest choice. And so she brought together a cross-section of leaders within the community, from public works to public health to parks and rec. And they got together and said, how can we make something like this happen in our community? And do we want to make this happen? And the consensus was yes. And from there, the Active Living Ramsey Community initiative was born.
Okay, but active living, do we mean we want everybody's circulatory system to be fully functional? I mean, what does it really mean?
Well, active living is a way of life where people can integrate physical activity in their daily routine. So it's, like I said, it becomes the easy choice rather than the hard choice. So active living, for example, would be somebody using a trail and walking with their family. It could be somebody taking a bike and biking to work as their commute or their transportation. It could be somebody using a local park and enjoying it after dinner with their family. Could be going in the backyard and gardening. There's all different kinds of ways, but incorporating it as part of your daily routine is really the main gist of active living, and really having a community that supports a wide variety of opportunities that are safe, accessible, and convenient.
So it's almost like habit management. You're trying to encourage good habits.
Sure, it's about making the healthy choice the easy choice. And so we can say, yeah, get out there and be physically active, but you can't even walk to a park because it's too dangerous. And a lot of times, we did a survey in Ramsey County, this is before I started, for urban and suburban, so the St. Paulites and the suburbanites, and asked them about their habits as related to physical activity. And what they found was there was a lot of barriers for people being physically active, especially to the people in St. Paul. Some of the barriers were traffic, lighting, a sense of feeling safe and walking. And so there's barriers in which communities can work together to try to reduce those so that people can easily incorporate physical activity in their daily routines.
Now, you focused particularly on kids, or is it's full spectrum? Are you trying to keep the geriatrics moving so that they live longer?
Well, it's really about quality of life for everybody, whether you're a young person or you're in your later years of life. We really are promoting health for everybody. If families are healthy, then young people will be more healthy. And we have a program, I don't know if program, it's actually an initiative. It's called, now it's being launched off as the Be Active, Be Green Recycling Bench Initiative. And that initiative is focused on creating bench routes for people so that they can be able to either enjoy a recreational loop or not a transit, but a transportation route, which they wouldn't feel comfortable if they couldn't make it to the whole way to their destination. So it focuses on making routes for people, the elderly, for people who may have a disability, or for people with young children. And the goal is for someone to be able to see the next bench and be able to say, hey, I can make it to the next bench.
Benchmarks.
There you go.
Okay.
I like that. I like that. I'm going to have to use that. And so we have a number of benches out right now, somewhere around 70 or so, and we're hoping to add several hundred more into the system. We have plans to do close to 300 in the Ramsey County Park system through some of our regional trails and through our parks, and then also open it up, and it's the opportunity for cities and communities throughout Ramsey County to do this. We just worked with, we had a meeting with MnDOT and the City of St. Paul and some district councils. And one of the opportunities people have in St. Paul is to put these bench routes wherever they would like in their neighborhoods, and they need to work with a local government to do that. And we will provide the benches for free. And we also provide a nice plaque, and they get to choose the quote on it from a selection of quotes about the environment or about physical activity. And so it makes it real appealing in neighborhoods for people to have this amenity. And the research has shown that when people have good lighting, they have benches, and they have things that make it a friendlier place to walk, they're more apt to be physically active. And we just met with MnDOT, which is the Minnesota Department of Transportation, and on Friday, and they said that on their project in Snelling, that they would be interested if the district councils would like benches in, that they would provide the concrete and install those along the Snelling Avenue project that's coming next spring.
Now, when you said we're installing 300 benches, it made me think you have staff.
Well, actually, no. I'm doing it myself.
Okay.
Yeah, exactly. We collaborate with all of our local jurisdictions, and this would be with the Park and Recreation Department, the 300 or so, or 200 and some benches, and the ones along Snelling Avenue is in collaboration. Would be with MnDOT. Usually, it's the city. The city would pay for the concrete and the installation, and the benches would be provided by us, and as well as the paver. But now this unique project with the Minnesota Department of Transportation, we were at a meeting, and I want to tell you a little bit more about that later, but one of the things I was able to bring to the table was this bench initiative. And if the community would like some of those amenities along the route for Snelling Avenue for people that are walking along that corridor, that we would be able to do that, and the Minnesota Department of Transportation would cover the cost of the installation, which was a really great collaboration.
Now, you've been at this for several years now, correct?
Yes.
You started in 04, is that correct?
Well, actually, the coalition started in 04. I started in 08.
Okay. And I have on the list of things to talk to you about accomplishments.
Mm-hmm. Well, that's Active Living Ramsey Community is made up of incredible people. It's people that are leaders in the community, people that are practitioners like staff people, staff engineers, or public health professionals, people that are professionals and are involved, as well as people that are advocates, people that care passionately about communities moving and being healthy. And a lot of people actually love riding their bikes for recreation and for transportation. And so we get together and we meet every quarter as a whole coalition, and then as subgroups we meet together. And the coalition has done incredible things because of the volunteers that are involved. We have about 1,000 people on our distribution list, and there's a large number of people that are engaged in some way or fashion. And it starts from the beginning of its roots in creating comprehensive plans, and I don't know if people know what that is, but it's communities planning for the future together. And they work with the Met Council to submit their plans and be able to help possibly know what each other's doing, so that maybe, oh, someone wants to do a trail there. Well, maybe we'll do our trail there so that we can connect. And through those comprehensive plans, an active living initiative actually was born. Communities have incorporated active living principles into the work of their plans. And that's really a big deal for people to be thinking that way for the future.
Now, I'm so used to St. Paul being a leader in so many ways. Are we imitating another city? Is there somebody else who's a leader in this?
Well, actually, the whole Active Living Ramsey community, the Active Living movement is a national movement, and Ramsey County, the Active Living Ramsey Communities, it is a mouthful, we say it a lot, but it actually is one of the leaders in the country in this movement. For example, We have all of our bike and ped facilities have all been inventoried and documented on what's called a GIS system. And we had the National Center for Biking and Walking come out to our community a couple times, and they've helped get people excited and get people involved. And they had said that, this is about a year or so ago, that we were the only ones in the country who had done this throughout its whole county and with its municipalities, being able to identify in the same way bike and pedestrian facilities. And the reason why that's important is because you need to share the same attributes, record the data the way, because when you create a map, the map doesn't line up if you haven't reported the data the same way. So a trail could be going here and it would line up, and it wouldn't work. So Ramsey County has been a leader in that, and St. Paul is about half of the county, and they have been instrumental in being a partner and helping to make all these things happen.
How much of your efforts go to getting people to start? I mean, once people are in the habit of healthier living and more active living, they tend to sustain, don't they? I mean, maybe they need some support so that they don't slack off again and just sit down on the couch. But how much of your effort goes to actually getting people to start?
Okay, well, our niche and our mission is to engage the community, to promote and create environments in which people can be physically active in their daily routines. And so we focus on policy, system, and environmental changes, because those are sustainable. If I go, or someone else in the coalition's not there, and we've changed a policy, or we've made Snelling Avenue better, and I do want to get back to that, because that's right here in St. Paul, that'll be there forever. That infrastructure will be there to support people in being physically active. So that's how we've focused a lot of our work on. We now are transitioning into promoting our facilities. Everything we do is really based in research, evidence-based research, and so we're more than likely going to get a good outcome from it because we're doing what research has said that works. And so one of the things we're doing now is promoting our facilities. And in Ramsey County alone, just the county itself, for the county system, well, I should say, let's say the whole county, St. Paul, all the cities, we have over 50 different what we call active living facilities, which are a recreational facility, from beaches to tennis courts to basketball courts to football fields. I mean, all different kinds of facilities. And what we're doing is we're going to be promoting those through a new, what we call our web portal, and it's called Go Ramsey Communities. And we're actually modeling it and collaborating with a few other counties throughout the state. And what people will be able to do is say, okay, this is where I live. I would like to take my child and play tennis with my child. And I want to go within 2 miles of my house because we can bike there. So it'll pop up all the different tennis courts that you can choose to go to. And it will also be able to have, it's going to be kind of fancy. People can say, I'd like to bike there with my child. And so you can pull up what kind of bike facilities can I ride on with my child to go there. And so I'll be able to show you what shoulders are, or if there's sidewalks, or if there's bike lanes. And so people will be able to hopefully more easily leave their car at home and be able to bike or walk to these facilities. So that's how we're helping to promote people being physically active. And the research shows that when you promote your facilities, people become more physically active.
How much does it hurt the Active Living Initiative, the degree to which physical education is being dropped from the schools?
Well, actually, that's a policy, and that's not an area that we work in Active Living in our coalition. But we're part of a much broader initiative that's going on in St. Paul and Ramsey County, and that's called the Statewide Health Improvement Plan that the Minnesota Department of Health has provided funding for. And part of the components of that initiative is the community, which we're focused on more of the community assets. Then it's also workplaces, as well as healthcare, and we're collaborating with healthcare, by the way, with this new portal. Healthcare plans are very interested in having their doctors and nurses promote that portal to their patients and encouraging them to be physically active. So like when they ask that question, do you smoke? And they'll say, and I was just with my daughter today, and she said, no, I don't. And they said, oh, well, good. Well, one of the things that some of our health plans want to do is have doctors move into asking their patients, are you getting a half-hour physical activity if you're an adult, or an hour if you're a kid? And it just helps create conversation and then give them a resource about this portal. So, getting back to your question, and you need to tell me it now because I got excited telling you about
just the degree to which it seems like you're the Active Living Communities movement is trying to get adults to stay
Okay,
active.
about the schools.
And
Yeah.
well, we're cutting
You're
back
right.
on phys
You're
ed,
right.
and kids
Right, exactly.
sit around and they're in the ninth grade, they're couch potatoes.
Right, exactly. And so, what I was mentioning, and I'm so sorry I lost that, but the other one was schools. And there's a group of people working together on school initiatives and changing policies, not only in the physical activity area and trying to, and actually I did work on that at the legislature, helping make it part of the curriculum. That was a long time ago. But the other one is also focusing on healthy foods in the school. There's been a real transformation inside schools on the kinds of foods that they're providing young people. And it's all really policy based. And some of the initiatives in the schools are getting kids moving more often and having recesses, and some I think even have those balls that kids sit on for part of the day, that instead of sitting in a desk. Because what we've learned about this, about obesity, is that sedentary lifestyles are very problematic. So you can be getting your recommended workout during the day, and then if you're sitting all day at your job, it can negate what you did. I mean, it'd be worse if you didn't do it, but getting people up and moving, whether they're students or adults, is really important during the workday.
Good. In case you're just joining us, I'm talking with Connie Bernardy about Active Living Ramsey Communities. Now, what are the primary strategies for, I mean, there's actually movement, there's diet, and there's getting the medical profession involved in really supporting to what extent this helps community health and outcomes, even for their own financial benefit.
Well, exactly. I mean, the healthier their population is, the less they're going to have to pay on medical costs. And they actually are collaborating with us. And one of the best messengers for the message that we're working on are doctors. One of the doctors in our coalition had said that he can save more by changing how a street is built and making it easier for people to bike and walk on it, safer, can save more lives than this person could as a surgeon.
That's amazing. Connie, we've got your website up right now. Anything specific you want to say about the website to steer people towards, or?
Well, stay tuned, because our new website is going to be launched this coming, well, actually pretty soon.
Spring,
it's
yeah,
spring.
it's spring.
Spring has sprung. I know people are still getting their last cross-country skiing in and that sort of thing, but it's probably by May or June it'll be launched, and people will be able to have access to those different facilities in which they can go and enjoy time with their family, or stop by after work or on the way to work, or use those facilities anytime during the day and the weekends.
Okay, you've been chopping at the bit to talk again about the Snelling project.
Okay, so that would be a great example of people collaborating together. And what happens is the Minnesota Department of Transportation does a lot of transportation projects, such as mill and overlays, which means they come in and they take off the first top of the part of the surface and then they leave. But they're bringing all their trucks in and asphalt in, and there's things that while they're in town, they can do. And what we're promoting is, instead of having our trunk highways be mean streets through our communities, because a lot of people are having negative consequences, whether it's injuries, car crashes, or pedestrian or bicycle crashes. We want to turn our mean streets into main streets in our community. And a lot of times people don't think of trunk highways as being main streets, but West 7th Street, Snelling Avenue, there's a number of streets in our community in which they are our main streets. And so now MnDOT usually comes into town and they leave, and nothing really happens different. And then they won't be back for another 25, 50 years for that piece of infrastructure. And so what we're doing is we're collaborating with them up front before they come in and scope the project and design the project. That's how what's the term, and construct the project. We're asking them, meet with the community before the project ever starts, before you ever start designing it. And we'd like to have the community have a say in how that street functions in the community. So we call it the creating process, and it's called context-sensitive design and solutions. And instead of having just the engineers have a technical problem to solve, they incorporate the community need, their technical problem, as well as regulation issues. And that becomes their problem statement up front. And then they're very smart people and well-educated and know how to design roads. And if they're solving a problem and a needs for the community, there's going to be a better outcome from that community. Instead of being a mean street, it might end up being a better main street and a safer main street. And so we just met with MnDOT, and this is a new practice for them. This wasn't by second nature for them. This is very new. And they're being very receptive to us, and they want us to, they even said, keep pushing us, because they want to make these kind of changes. And so on the Snelling Avenue project, we had over 80 people show up at a community meeting. And then the Minnesota Department of Transportation engineers came and listened to the community. And the community members were able to share their ideas. Where have I experienced problems on Snelling Avenue? Where do I find it unsafe or dangerous? And they were able to articulate those to the engineers, and we collected everybody's comments. And the engineers actually called the next day and said, you know, we used those comments when we were in White Bear Lake when we improved Highway 96. Could we get those comments again? Because they were really helpful. Cool. And so, and it's like, you know, it's kind of a no-brainer, but those things didn't happen before, and those kinds of dialogue and conversation. And so the Minnesota Department of Transportation now they're incorporating, they were far into the process, farther than at the beginning, but they're willing to take the community's needs into account now. And the projects got postponed for other reasons, and now what we've requested is for them to do a safety audit, because we think that when you're doing your planning, it ought to help increase safety along that trunk highway. And so now they've agreed to do a safety audit of it, including bicycle and pedestrian safety. And so Snelling Avenue will be different because of community participation and community involvement than it would have had Active Living Ramsey Communities collaborated with Sierra Club and other groups to be able to have the community's voice be heard. And it's a win-win for everyone.
To what extent is the central corridor going to affect active living? Are people going to get more exercise because they're taking the rail basically up University Avenue, and then they're on foot or bicycle from there? Very
good question. That's a very good example of incorporating active living in your daily routine. People that use transit get 20 minutes on the average of physical activity a day in. And that's, for adults, the recommendation is 30 minutes, and for children, an hour. So right there, by using transit, the average person's almost met their extra physical activity a day. And so getting to the central corridor would be really important for people, as well as using the central corridor.
Tell me more about your accomplishments.
Okay, well, we talked about comprehensive plans have now been in place for each of the communities regarding active living. We this isn't in St. Paul, but it's an example that helped us move towards getting Snelling to be a safer place and making it more efficient for people to use, so they don't have to like walk further down for a safe spot to cross, or making it more accessible to somebody with a disability. On Highway 96, Minnesota Department of Transportation was going to do the same thing, come in town and leave. The city found out from me and us, our coalition, that they were going to be doing a mill and overlay, which the process ought not to work that way. Mm-hmm. And so citizens organized, and from that what happened was MnDOT came in and said, we're going to add, and this is really unprecedented that we know of, add another foot on each side. It wasn't going to affect anybody's right of way or anything, and then do a road diet. When from 12 feet to 11 feet, it makes a road. Oftentimes, it makes a road safer.
What's a road diet?
Instead of having the lanes be so large, like a speedway, narrowing them up, and in urban areas they can be 10 feet are considered safe. In this area, they went from 12 to 11. What that allowed was, on the Ramsey County side, there was a 3-foot shoulder. By adding an extra foot on each side and doing a road diet, a foot on each lane, we now created a 5-foot shoulder, and paved it the same way as the roadway, which made a bike facility for people in that area. And a lot of people go around the lake and use that area. And so through our collaboration, we were able to make that happen. Unfortunately, Washington County people didn't organize and try to influence MnDOT to make it safer for people biking and pedestrians. And we tried, but the process didn't work, and for the Washington County sides, it narrows down, and I'm told that there's anywhere from 1.5 feet to 3 feet of shoulder as you go all the way to Stillwater. And the goal would have been to have a nice bikeway all the way to Stillwater. That's what we tried for, and we hope that we change the system in the long run, so we're not putting out fires and saying, what a missed opportunity. They're not going to be coming back for 25 years or whatever it is, and now we don't have a bikeway.
Yeah.
And it's a designated bikeway, for heaven's sakes. And it ought to have a safe facility, because people are going to bike on it anyway. It's whether they are actually really safe or not is the issue.
Okay, we've got about 3 minutes left, so I'll give you a second to think about what you want to conclude with. But I want to ask about downtown. So many people commute downtown, live downtown, well, not live, but commute downtown and work downtown and walking through the skyways. Is that part of the environment you're talking about?
Well, yeah, well, the skyways are a brilliant brainchild for people to get people to be able to be physically active and not even have to go out in the cold. Yeah, so that's awesome. We don't take any credit for that. Obviously, someone was visionary. But we're looking at the Union Depot and putting together all the plans that have been made and identifying how are people going to get in on their bikes and leave, or walking, because it's going to be a hub, a multimodal transportation hub, and how can people come in as well as leave. And so we're doing a study on that we'll be sharing with the community through a Green Corps member that we were awarded through the Minnesota Pollution Control Agency to help get people out of their cars and to bike and walk.
Okay, we got about 1 minute left. What's your elevator speech? What do you say when people ask you?
Well, if people want to get involved and make a difference, it's as easy as getting on our coalition mailing list and learning more about bike and pedestrian infrastructure and the policies and system changes that can happen. It's advocating for a roadway, Snelling Avenue, or a project that they're interested in. Now Cayuga Bridge is going to happen, and there's going to be a meeting on April 5th that MnDOT is sponsoring that people need to turn out for at the Federal Highway Credit Union from about, they need to check on the website of MnDOT. But it's a huge project. So getting involved and having your voice heard about how do you want your roads to be in your neighborhoods and your community.
Well, Connie Bernardy, thank you for your public service, and thank you for informing us so much about active living in Ramsey Communities.
It was a pleasure to be here. Thanks, John.
All right, thank you. You've been watching the St. Paul Forum. I've been with Connie Bernardy, Active Living Ramsey Communities. Join us again next week. Thank you.